Thank you. I was wondering if everyone was going to come back, and so it is good to see that almost all of the tables are full. Today I have been in several of the sessions, and it has been great to listen and participate in a lot of robust discussions around behavioral health, workforce, Medicaid, and really just the transformation of healthcare. And so what I was hoping to do for this closing session is I'm going to spend a little bit of time reflecting back. I've been in this role as commissioner for the past 11 months. I want to share with you a little bit of what it's been like. We've been really focusing on 4 significant sprints or arcs of effort, so I want to spend a little bit of time talking about that and sort of the vision moving forward for the Department of Health. But I want to make sure that I save time so that we can actually have a conversation. I love a bi-directional conversation where you guys have the opportunity to ask me questions. So that's the focus for the next 30 minutes. So November, it's almost been a year. I have been in this role as commissioner for the Department of Health. It's humbling. I'm incredibly thankful. 1,500 employees, 5 divisions, passionate staff. I love it. It is fun. I learn something new every day. And some of the work that, and this is not, I'm not going to list off everything, but some of the highlights of the work that I have been engaged in is really supporting the Division of Public Assistance. They're going through a significant, what we call a business process redesign. As you know, there was a backlog. They were able to clear that old backlog. We're really looking at the staff, the organizational structure, the tools they use for the job. We want to make sure that we're customer service focused. When an Alaskan comes in need of public assistance, we want to make sure we're using a one and done model, whether it's in person, over the phone, or virtual, that we're able to receive that application, process it up to the point of that interview, and have that interview scheduled so we can stop this churn. So I'm really, we've made a lot of progress within the Division of Public Assistance. We have more work to do, but we're on a positive directory moving forward. I would also say that that is coupled with the legislature appropriating additional funds for the IT, just moving off of these legacy systems into this integrated eligibility enrollment system. We're really excited. There's milestones. We are on track with those milestones. It's still going to take a couple of years, but we have the right staff, we have the right contractors, and there's meaningful and positive work that's happening in that space. And I'm excited to announce that we're on track for the end of the calendar year, just a few months from now, launching online SNAP applications, which is good news. Medicaid. We've had 2 significant work in Medicaid. One is this spring, we actually transitioned our fiscal agent, and the transition was good. There were some bumps in the road, and as those bumps were identified, our staff really leaned in and addressed those, which was really good. In addition, as you all know, in April, we started Medicaid redetermination, which was paused for the prior 3 years. The ex parte process is new. Every state is doing something a little bit new, or different, I should say, and we are really relying on and working with all of our partners, because it's going to take all of us to really support those on Medicaid. 1, update your address. 2, make sure that when you receive that envelope that you're responding to it, because we want to make sure that all Alaskans have health care coverage, whether it's on Medicaid or shifting to another type of insurance. So that's been a lot of work. We have also received funding from the Division of Insurance through one of their programs. They gave funding to the department so that we can look at our Medicaid rates and really look at the methodologies that we're using. And so right now we're in the process of drafting that RFP, and really excited about just really taking a step back, looking at those 94 different provider types and looking at the methodologies that are used to evaluate rates and just doing a refresh on those methodologies. We've also received funding from the legislature to increase funding towards congenital syphilis. We really want to be proactive in screening all women who are pregnant, and if they screen positive for syphilis, we want to make sure that they have the meds so they do not pass it on to their baby. And so we're really excited that the money is out there, it is working, and we're excited to see the outcomes with the goal of decreasing congenital syphilis. In addition, we also received funding for tuberculosis. That funding, as of this week, is out the door and in the hands of our grantees. And so we're really excited about, again, increasing the screening, identifying those that have tuberculosis, ensuring that they are connected in with a provider for their different med treatment plan. So a lot of work. Again, this is just some of it. It's not everything, but again, just sort of reflective of the work that's been happening over the last 11 months. And then I would actually be remiss if I didn't share one more thing. We celebrated our 1-year anniversary on June 30th. We've been the Department of Health. We went through a significant department reorganization. And I have to tell you, I'm so thankful it's a much smaller department. I could not imagine doing this job with a large department. And really this reorganization, it's really allowed me the opportunity to really dive in deep to support the division directors to understanding their programs, their budgets, and really pulling together these divisions so that we're breaking down those silos. I've also been afforded the opportunity to have town halls so I can listen to the staff and ask them, what is working in the Department of Health? How can we improve? Some of the things that our staff have identified is that, IT, HR, and procurement, if there could be more efficiencies in those areas, which is really the backbone of the work to support program and policy, it would really help us that we would be more timely and efficient. So I've really been spending a lot of time in those 3 areas so that our staff feel supported in program and policy as we're asking to make significant changes over the next 3 years. All of the work that we're doing, though, is really nestled really nicely with the Governor's Healthy Families Initiative. So last January, during the State of State speech, the governor announced his initiative. His vision is that Alaska would be the best place to live, work, and play, the best state to raise a family. He has 3 pillars under his initiative: healthy beginnings, improving access, and healthy communities. Now, when you see healthcare access, I want you to know that is not just primary care, physical health. That also includes behavioral health. It's the health of the whole person. And so again, the work that we're doing is really all tied into and connected in one way or another to the Governor's Healthy Families Initiative. So I mentioned sprints. There's a lot of work that happens within the department. And we have really focused in and are having very intentional conversations around these 4 areas. And so I just want to give you a little highlight on the work that we're doing. Childcare. We know access to quality childcare is important because that is linked to workforce, which is linked to the economy. And we know that through the pandemic, there was a lot of childcare closures. The governor issued an administrative order, created a task force. We have great members on the task force. They are all providers, representative all across the state of Alaska. We started in June. We're meeting twice a month. And it's been really proactive, really deep dive conversations. Many people, when they hear task force, are like, oh, they're not going to do very much. I'll tell you, every single meeting has been open to the public, and we're averaging between 50 to 70 individuals, including the media, that have been participating and listening to these task force meetings, because I think it resonates that we do need to change and increase access to quality childcare. So we did landscape and then sort of even setting, what does it look like for childcare in Alaska? And then we divided it into 6 topics. The first 3 was we did a deep dive. What are the barriers to background checks? What are the barriers to licensing? What are the barriers to workforce? And that's been the focus that we've had over the past 5 months. And it's been very eye-opening to learn and to connect and say, here's some low-hanging fruit that we can work on now. And here's some things that we need the legislature to respond to. And we will be producing a report with those recommendations. It's important for me as commissioner that as we're having these conversations, we're reflecting back what the recommendations are that we're hearing from the public, and we're asking all of you, does this resonate? Does this resonate with you that, yes, these are recommendations that will help efficiencies in background checks, efficiencies in licensing, and address the workforce shortages? So we're really excited. That report's going to be coming out soon. We want your feedback, and then it will be finalized, and it will be sent to the governor and the legislature for consideration. But we're not done with childcare. There's 3 more topics that we need to talk about, and it's access, quality, and subsidies. Subsidies is the big elephant in the room. There's been a lot of conversations around subsidies. But what we needed to do is take a step back and build these topics on top of each other. We also have contractor support that is helping us do deep dives in these areas. So we need a market rate survey. We need the workforce study completed so it can build on the cost of care study that will actually help us inform what are the right subsidies that the state of Alaska should be changing or engaging in to really increase the access to quality childcare. That second report will be done this summer. We're trying to move it up. We know the legislature is very eager to respond to these reports, and so we're doing the best we can. But again, a lot of great conversations. The next is around behavioral health roadmap. There has been many sessions today talking about what are the issues to access for youth mental health services. We recognize there are gaps to access to youth mental health services. And so it's great to hear those conversations, and it's also connecting with the work that we're doing, which is, one, as the Department of Health, we needed to form a statewide steering committee made up of many of the representatives here in this room or the organizations to say, help us frame this. And then we need to go out to the regions and we need to listen first. What are the issues? What are the solutions to those issues? And there's 5 regional meetings. 2 of them are completed. Interior region, which happened in Fairbanks, was August. The northern region, which happened last week in Nome, is completed. The feedback, very different from both of those regions. Next week, Southeast has their regional meeting, and it will be in Ketchikan, followed by South Central, which will be held in Matsu in November, and then there's the YK Delta that will be held in Bethel in November as well. I encourage all of you, if you have an interest in behavioral health, please attend one of these regional meetings. Engage in the conversation. All of the recommendations will be compiled. Again, we want to compile it, send it out for public comment for that concurrence. This is what we hear. Is this really going to be meaningful in addressing these gaps to youth mental health services? Get that concurrence from the public, and then what's going to happen is the Department of Health and the Department of Family and Community Services will use that as our roadmap as we are addressing those gaps. The next is complex care. And the discussion of complex care, and I'll give you the definition first, it's a client, it's a patient that uses more than one service within a division, within multiple divisions within a department, or with multiple departments. And it's really the Department of Health and the Department of Family and Community Services predominantly. And these clients, what we're seeing is they're following through the gaps. They're not able to find the right setting to live in. And so under Dr. Ann Zink, she actually, when we were the Department of Health and Social Services, pulled all the divisions together and said, what do you do and every division presented to each other. She took that and she kind of organized it into 3 groupings. The first, and we've been doing this for several months, is every week there's a crisis response team made up of staff from both departments that come together, and they're really doing that case review of that client and figuring out that placement for that client. Their issues that are identified are then pulled into a monthly meeting that we call the Complex Care Committee. It says, here's the consistent gaps that we're identifying. What are the levers that we need or waivers that we need to change within our control to address these gaps so that client doesn't keep falling through the gaps? There have been really fruitful conversations. The third part, and we're not ready for this yet, but we know that there's eagerness, is really bringing in the stakeholders to be a part of this conversation. I was just at Covenant a couple of weeks ago, and they said, we have 2 clients that take 90% of our staff time, and we really need help supporting these clients. And I said, I hear you, and I want to engage, and let's figure out what we can do temporarily before we build in this capacity to really bring in stakeholders. So again, a lot of work around complex care, and I'm really excited about the conversation. So we can really get narrow in what are the issues and what changes need to happen within these waivers. Finally, that brings us to transformation of care. And I know that there's been many conversations. I ran into Deb Erickson earlier today, and she's like, I'm talking about that. I'm like, that's good. How do we transform the care in Alaska? And this is really, there's CMS has opened up new opportunities for states to apply to if they so wish. And so the Department of Health is really in this exploring these opportunities. We are looking at how other states have implemented these waivers, and really just having conversations with our tribal partners and with our other advocacy groups and other stakeholders, like, is this a need? Is this going to support Alaskans? I will identify sort of 3 of the waivers, 2 of the waivers in a grant opportunity that have been in discussions. One is around health-related social needs. Many states have applied for health-related social needs, and it's really centering around food is medicine, care coordination, which is not covered by another waiver, and housing. There needs to be a medical need. It is specific to the Medicaid population, but we're really evaluating what are the needs as we're looking at the health of the whole person, and what is not being met, and how can this waiver meet these needs. The second waiver that CMS opened up in allowing states to apply for is the incarcerated population. So before an individual completes their sentencing, it's allowing for that incarcerated individual to be screened for substance use disorder. If they screen positive, to be connected in with a provider, and if appropriate, onto a Medicaid-assisted treatment to help them as they're transitioning out of that incarcerated setting. It's something that we've had some preliminary conversations with the Department of Corrections, identifying, how would this work? How would we work with each other as we're supporting the incarcerated population that's coming back into our communities? The third, which is very new to us, is a grant opportunity from CMS, and it's called the All Payers Health Equity Approaches and Development. This is something that is very much in partnership with the Division of Insurance. And it's exploring and looking at what it is and is it appropriate for Alaska. So I invite you to be a part of these conversations as we're exploring together what makes sense in the coming days and months as we're looking at how do we transform care in Alaska. And as we're having these conversations, I have the next slide up, and it's really we're asking 3 different questions. Again, I mentioned we're listening first, we're asking questions, we're exploring, but we're also saying, okay, the Department of Health, we serve all Alaskans. Public health is for all Alaskans, right? Medicaid within healthcare services serves the Medicaid population, but we need to have that approach of looking at all Alaskans. The Division of Insurance works with all of these private insurance companies. How are we evaluating what are the appropriate changes within Medicaid? How does that align with these private payers? So we're looking at the whole health of Alaska, and these are the conversations that we want to be having with you. So who are we serving? The second is, what are we paying for? What are these services that are under these new waivers or grant opportunities? And are these services really incentivizing and moving towards prevention, moving upstream to decrease the high cost and high expenses downstream? Thinking of chronic disease as a great example. How are we really focusing in on decreasing diabetes and hypertension and obesity, which are the highest cost drivers right now within Medicaid and all of the other insurance companies? And then how are we paying for it? We want to make sure that this transformation of care is really aligning with how to support the individual or the provider instead of the provider or individual having to figure out how to align with that payment system. And so we're really asking the question of the how. These conversations that we're having is really in partnership with all of you. It's in small settings until we gather into large group settings. It's going to be a conversation with the legislature. And it's really, all of this is sort of like, why are we doing this? And it goes back to the governor's Healthy Family Initiative. We want healthy families. We want to drive down the high costs of health care, and we want to really move upstream into prevention, because we know if we have a healthy population, healthy Alaskans, we're going to have a healthy economy. And I think that there's alignment. I think we can all agree with that because we've learned so much through the pandemic. So with that, I want to kind of give you the vision moving forward. It's very simple. It is that we are, the Department of Health is increasing the health, the well-being, and self-sufficiency of all Alaskans. It's that simple. And we're going to do that by leveraging public health as that chief health strategist, supporting public assistance as they're going through this business process redesign, really moving in that customer service, meeting that Alaskan, whether it's virtual, in person, over the phone, in that one and done model, so we can stop the churn, right? So it's timely. Looking at Medicaid reimbursement that is timely and accurate reimbursement to providers. And that we're focusing on access to quality childcare, because we know access to quality childcare is linked to the workforce, which is linked to the economy. And we're also looking at what are those gaps in the behavioral health continuum of care, and how are we addressing those gaps? And I talked about our sprints. There's a lot of work happening with that, but it's going to be in partnership. So I have the 5 Ps. And this is my challenge to you to engage, and all of you fit into one of these 5 Ps. It's the people. People are the department staff, whether it's Department of Health, Department of Commerce, Department of Family and Community Services, Department of Admin. It's the department staff and the advocacy groups. It's the providers, okay? Those that are providing care to Alaskans. It's the press. We need the media to be a part of the conversation, to cover these stories and talk about what is happening in Alaska. It's the policy. We need the legislature to be a part of this conversation. I'm so thankful that many of our legislators are here today. And it's the public. We need the general public to be aware, because we are all Alaskans supporting each other. So we have the 5 Ps, and we're going to be leveraging the 5 Ps of success. One is positivity. I know that we can do hard things. Leading through the pandemic, being told we have 7 days to set up airport testing, and we did it. To have vaccine dissemination go so quickly, we did it in partnership with our tribes. To have access to monoclonal antibodies, we had that in a community setting. We can do hard things when you're positive, looking forward, saying, you know what, we can do this together, working together. It's being proactive and being prepared, asking who's missing from the table. We don't want to have an echo chamber conversation. We want everyone together, working together, rowing in the same direction. And it's passion and promotion. I have passion in the belly for the work that we do and for our mission of the department. I know our 1,500 employees do as well. They're subject matter experts across the fields within the Department of Health. And you guys are passionate in your areas. So as we come together, I truly believe that over the next 3 years, we can make meaningful difference in transforming the care so that we have healthier Alaskans and a healthier economy. So thank you for listening. I do want to open it up to you to see what questions do you have? What did you hear that spiked some interest? If I can't answer your question, I do have my staff up front, and so they are here to help answer some of those questions. So I think we have 2 rovers, so just raise your hand and let's engage in a conversation. And don't be shy. Okay, I'm going to start calling on people. All right, ask your questions.
Is there any low-hanging fruit that you have identified so far?
On which topic?
Any of them? Throwing you a softball.
Yeah, thanks. I appreciate that. I have to tell you, Child Care Task Force, we were getting ready for background checks, and we said, okay, so, what is the process? What's the issues? And I do think it's low-hanging fruit. It's really moving to electronic fingerprinting and having a portal for child care providers to submit their background check application. And so it was through prepping for the meeting. It was like, this is what we need to do, and leveraging our ARPA funding that was nearing expiration and just connecting the two together. It was timely. That was low-hanging fruit that we were able to say, yeah, we can start working on it. So it will still be a recommendation from the task force, but something that we're actioning right now. And I think once we roll this out and test it, I think that's where I know that there was conversations with licensing with Department of Commerce saying this is a model that you can adopt as well, because we know that background checks, timely background check processing can be cumbersome sometimes.
Hi, Commissioner. Thank you first for the great job that you've been doing. Your enthusiasm gives me tremendous hope for the progress we're going to be able to make. But my question has to do with some of the conversations I've been having here has been about peer counselors in substance abuse type situations. But it's always the question of how do we pay for it? What are your thoughts? Any suggestions?
Thank you, Senator. I appreciate that. So I'm going to pass that over to Emily Ritchie. She's our Deputy Commissioner. Here you go.
Hi, Emily Ricci, Deputy Commissioner with the Department of Health, and the 1115 waiver does allow us to pay for peer support services. I think part of what we're looking at right now is we're in the process of renewing the 1115 waiver right now, and technically there's almost like 2 pieces of the waiver. We have put forward to the Center for Medicaid and Medicare Services that has to ultimately approve renewal of the waiver, what we're calling a clean waiver, meaning we're not recommending a lot of changes, mostly because we want to get the waiver renewed. It is absolutely essential to the functioning of our behavioral health care system in Alaska. It's been transformational in terms of paying for services like peer support services. But we recognize that like any process that's in place, any program that's in place, there are things that we can do to change that. So our focus right now is on getting that renewal approved by CMS. I just got an email this morning saying that they still believe they are on track to approve the renewal at the end of the year. We have regulations, state regulations as well. They're in the public comment process. And I think those provide an opportunity to address some of the gaps or some of the challenges that we've seen with the 1115 waiver once it's rolled out. But once both of those items are complete, particularly that federal approval for the 1115 waiver, we really want to start engaging in a conversation about, what does the next step of the waiver look like? Are there things that we can be doing to further support things like peer support services, which are really important when we're facing a workforce shortage especially. So there will be opportunities for us to, I think, look at, questioning, for us to consider if what we're doing is sufficient, and if not, what should we be looking at to do more of?
Perfect. And I think we're running into time, but if we have a few more questions, like here's your opportunity, you can ask us anything.
Hi. I agree with Kathy. Your enthusiasm and your passion, I agree. I'm very passionate. I'm home care. And we've talked in different forums a lot about the delay in background checks and getting workers up and running compared to other organizations that don't have that type of thing. Community care is the lowest on the continuum of care, but in addition to a background check, we have up to 42 days, calendar days, on the fiscal agent to certify our caregivers. So what can we do with that passion to help eliminate those delays when they're just asking for things that we've already provided them for? If you can talk to that.
I don't know if I can speak specifically to that, but this is what I'll tell you, and this is what I've recognized being in this position for 11 months. You know what the issues are, and you have recommendations. One of the, early on, it was like November, the Food Bank of Alaska came to me and said, there's a backlog of a SNAP, we're seeing an increase in, people coming to the food bank, and they gave me a one-pager, and it was like 11 different suggestions. And I said, this is so helpful because you identified the problem and you identified the solutions. Let me take this back to my team and let's figure it out. And we worked all of them, and one is a policy that we're just working through. And it's more of just capacity and time to understand what this policy is. And so it's really helpful. So I would encourage all of you, if you're like, there is an issue, very simply saying, and here's the solutions, and meeting with us. I know April said that, it's great because I can just call up the commissioner and have coffee. My team, the executive team, which includes all of the division directors, we love meeting with you and listening to what are the problems and what are the solutions and how can we be action-oriented to make these changes. I have incredible support from the governor. The governor is very passionate about healthy Alaskans, about his initiative, about healthy families. And so I do think that we have this opportunity. I feel support from many of the legislators that we can make changes, but we really need to know what is the actions that we need to take. If it's federal, it's gonna take a little bit more time, right? If it's working on changing, statute, it's gonna take a little bit more time. The regulation process, we're seeing it actually go through a little bit further. Unless there's a lot of public comments, then it takes us a while to go through those. But again, I would say come with your solutions. We really want to have those conversations. Oh, one question back here.
First, again, Commissioner Hedberg, my name is Cody Chip with Elevation Counseling and Consulting. I also want to acknowledge and really appreciate the enthusiasm and passion and really, truly the action-oriented steps that the Department of Health has taken. For example, really listening and hearing and executing, most importantly, executing the pause on service authorizations for routine behavioral health services. That is, based on my math, which may or may not be the best, but saving anywhere from 40 to 50,000 clinical hours and staff time hours that can actually go into clinical services. So truly, it's a pause. We need to make it permanent, but thank you for that work. My question, though, is around, really appreciate the focus around healthy families, healthy kids, and you can't have healthy families and healthy kids without healthy schools. Yeah. And so I'm wondering where does school-based Medicaid fit into this roadmap looking forward into the future?
Yeah, that's a great question, Cody. And I might just frame it a little bit, and then I'm looking to my team to kind of help out. That is something that has continually brought up. We want to work with schools, and I think that you'll see some changes coming up this legislative session. I think it's sort of working through those processes of how we can support and engage with schools more, because we know school-based services are really important. I think on the flip side, it's the capacity on the schools in order to, whether it's behavioral health or primary care or something else. I think there's also a capacity issue within the school districts, the schools themselves. And so I think it's sort of like, what is the model that works best? I do know, like, Volunteers of America, that is Anchorage-based, they're in 10 of the schools here in the Anchorage School District, and it resounds well and it's very positive. So how can we replicate this across other school districts? Do you have any comments, team? Oh, Emily might have comments.
I will be very short, but I think, there have been some new, I would say, changes from the federal side that have come out in the last few months about thinking about how Medicaid can provide those types of services in schools. When we think about what we're exploring, that's something that is top of mind, thinking about prevention. How do we start reaching out to our kids and our youth in Alaska as early as possible, particularly using the institutions that exist that they're participating in. And I think this ties into the behavioral health roadmap that Commissioner Hedberg was talking about earlier. We were just in Nome last week, and we had some school counselors that participated in the behavioral health roadmap, and the feedback that they provided in terms of what can we be doing within the state to help our youth and to address the youth crisis was specifically thinking about how can we bring more services into school, and how can Medicaid play a role in that. So that's absolutely something that we're talking about in multiple areas of our work.
Perfect, thank you. Well, I think that we're at the end of time. I got the signal that we're at the end of time. But truly, this is about partnership. This is about all of us having this conversation and continuing these conversations. You know the work that we're working on right now. How do you plug into that? What are we missing? Let us know. Very thankful for everyone coming today and coming back to this closing session. With that, thank you. Bye.